Say a bit about what you're hearing from your members about reform, what the discussion is like. Let's start with that.
Well, at a national level, we keep hearing the business community is completely opposed to the healthcare reform. But I can tell you that in most chambers, most local chambers, we have a very broad spectrum of opinions on healthcare reform because we represent a fairly broad spectrum of the community. We've got, small businesses, large businesses, businesses that are owned by people of all different political backgrounds. So what I'm generally hearing from my members is that there certainly is a need for some sort of reform in healthcare. For about 10 years now, most of my members have experienced at least low double-digit increases in the amount of money that they're paying in their premiums for the health insurance for they and for their employees. And at some point in time, it becomes, for most businesses, untenable to maintain the programs that they had. So over the last 10 years, you've seen an erosion either in the benefits that employees receive or in the amount of participation the employee has to have in health care in order to be able to continue to get those benefits. So, for instance, just in this organization that I run in the chamber, we went from 10 years ago having a fully funded healthcare program for all of the staff and partial payment for dependents to a point now where the healthcare is only paid for the staff and only at 80%. The staff is paying for 20% and they're paying for all 100% of their dependents. And even at that, it still is not at the level that it was 10 years ago. The benefits aren't as good. So that has happened time and time again in millions of businesses all over this country. And businesses are at a point where they've sort of decided we've got to have some changes to this. Now, they may not either understand or, if they do understand, like the changes that have been made, but I think there's general agreement that we've got to have a change. Now, based on what we're seeing currently, what I'm hearing from my members is, from a lot of them, not all of them, but from a lot of them is, especially the smaller businesses, sort of trying to figure out how we got to this point that we are today. When healthcare sort of went into the insurance realm and stopped being, the doctor would come by your place and do the house call. The way that health insurance sort of started out in businesses was when we had wage freezes during the Second World War. There was a need for businesses to still try and find ways to differentiate themselves, to give some advantages to employees to come and work for them because they couldn't pay them more. And so one of the things they did was they started to provide health insurance. And it's from that we've sort of morphed into a system in this country where it is essentially expected, and in some cases, in some states, based on size of business, now mandated that you have to provide health insurance. And a lot of my smaller members are saying, how did we get to this point? Why is it my responsibility? These are maybe companies that have 2 or 3 employees, where in order to be able to deal with healthcare issues, owners are at times having to take 2 to 3 full work days a year out of their time to be able to meet with insurance brokers, figure out, okay, I've got a 20% increase this year, so in order to be able to maybe, I'll throw a little bit more money in yet again this year, but I can't meet the whole 20%, so I have to buy down the advantage to my employees, or I have to figure out how much more they're going to pay into it. And then if I increase the amount of money that they're going to pay in, is that legal? Are there rules around that? These are all things that small businesses are sort of scratching their heads wondering, why is it their responsibility to deal with? So I think for the most part, a lot of small businesses would love to see something where it isn't their responsibility anymore. If they need to help to fund that, that's one thing. But there's a difference between paying into or partially paying into a system for healthcare and being the person who is responsible for the healthcare provision to your employees. And I think that's where a lot of smaller businesses are starting to draw the line.